How you ladies doing tonight?
I'm doing well. How are you?
A little tired. I work nights. So I'm a little.
Oh
I
yeah.
miss night shift.
Yeah, I love it. It's the
Maybe
best.
3 days a
But
week too, but hey.
I'm actually going in for a shift in like an hour and some change. So
bless.
I don't even know how you up right now. Like,
yeah, I can function on.
I needed to get
Yeah. But yeah, it's you get used to it.
Hello. Yeah, for sure.
Okay, here we
Hello.
go. Here we are. Sorry, my internet's acting crazy. We're live, and before we begin a formal conversation, I just really want to thank you all for coming through. I think the students really will benefit from this and appreciate you all sharing. Ashley, I think you started talking to Jovalie, Tiffany, and Dr. Watkins. You're on. I saw your screen. Can you guys see Dr. Watkins, or is his screen?
Sorry.
Yeah.
Okay, no problem. No problem.
Yeah, I had to get some water.
Oh, okay, no problem. All right, cool. So let's go ahead and begin with some introductions. The purpose of this panel, really is to inform students of their options in healthcare, and so I think they will benefit much from this. They have created some questions to ask you all, and if you want to add anything else or share anything else, please feel free to share. All right. So why don't we begin with introductions? Jovalie, you want to begin? We go with Jovalie, and just anyone just pick up.
Okay, sure. My name is Jovalie Thompson. I am a nurse. I work in the neurosurgical ICU at Washington Hospital Center. Actually, I work on it's 2 units that I work on. One is a neurosurgical ICU, and then one is like a mixed ICU. And sorry, I lost you guys. But I'm from DC. I was born in Jamaica, but I was raised in DC. And I've been a nurse for about 2 years.
Awesome. Thank you, Jovalie. All right, who's next?
I guess I'm next.
Yeah.
My name is Tiffany Hogan. I'm a respiratory therapist. I am born and raised in New York, but I came to school in the DC area. Actually, that's where I met Ursula. And I've been a respiratory therapist. It'll be 10 years on Valentine's Day. I work at Shock Trauma in Baltimore. So that's where I've been my entire career. I've worked at other hospitals intermittently. As a respiratory therapists, we go all over the hospital. We see everybody. But as the beginning of this year showed, COVID hit, and that's kind of where I've spent the majority of my time in a COVID ICU, one of our main ones. And it's been an interesting ride, to say the least, but that is what I do.
Awesome. Thank you, Tiffany. Everything you're doing. Who's gonna go next?
I can go if you don't mind. It's up to you.
Okay.
Ashley, Miss Ashley.
Go for it.
My name is Julian Watkins. I'm a physician, internal medicine trained. I'm currently working at the New York City Department of Health and Mental Hygiene. I was initially working in the Bureau of Sexually Transmitted Infection Control, but when COVID hit, I kind of transitioned to public health in New York City. So I'm a public health practitioner mostly now, but I do still see patients once a week. And yeah, I mean, I guess we'll talk more about public health and that kind of side of things now, especially with the pandemic. I think there's a lot more attention on this concept of public health.
Wonderful. Thank you, Dr. Watkins.
Yeah, and now I'm definitely glad that you got to go first because I'm in public health too right now. But yeah, I'm on a whole nother different side. Y'all putting in the work. So let me just say hi everyone. My name is Ashley. I am a nurse currently with the Family Tree. I do community and public health. Wouldn't you know? I have been in community health ever since I started. Ever since passing boards in 2012, and that has been my calling. I thought that I was gonna try some regular, bedside nursing, and that was about 9 months ago, y'all. That was about 9 months ago, and then I said, you know what? Maybe it's not my time. So thank you all for all that y'all do in the capacities that you are in. Born and raised Cincinnati, Ohio. Go Bengals. We're not going to talk about that game. But yeah, we're not. And I am here in Baltimore. Oh my goodness, since 2012. 2011, actually. Nurse since 2012. So happy to be here. Can't wait to talk to you guys.
Awesome. Let's get right into the questions. Thank you, Ashley. The first question is, why did you choose this career? The students want to know, why did you choose this career? So why did you choose the career as a nurse or as a physician?
I'm like, how we doing?
Anybody can go.
The nurses want to go first, and then, whatever you guys want.
Yep.
Okay. So I will start, I guess. So I chose nursing. Actually, didn't think that I was going to be a nurse. When I went to college, I was pre-med, and by my, I think, sophomore year of college, junior year, I decided that I did not want to be pre-med anymore. But I was a neuroscience major, and I was interested in that, so I opted for the research route. And then after I graduated school, I thought I was going to do a PhD program in neuroscience and do research, but ended up not working or pursuing that. So I was at a loss. I was kind of in this limbo period and didn't know what I wanted to do. And I was encouraged by my sister, actually, to just think about nursing. And I was never really interested in nursing as a field. I was just like, oh, okay, well, I was coming at it from a research angle because that's the frame of reference that I had. So I was like, okay, let's look into nurse researcher positions. What do they do? So I delved down that pathway, and then I stumbled upon the nurse practitioner position that I was not aware of, that this existed before my doing that research. So I discovered what a nurse practitioner was and their role, and how they operate in a provider role. And I decided that was more akin to what I actually wanted to do with my life. So then I just exposed myself to a lot of healthcare and decided that nursing was what I wanted to do. And then I went to nursing school, and here I am.
Awesome. Who's next?
We're going to go with you, Tiffany.
Okay.
Follow the order.
Okay. All right. I can't say I really chose this career per se. It kind of chose me, the way that things lined up. Like Jovalie, I started off pre-med my whole life. I told myself I was going to be a doctor. And when I got to school, that was the track I followed until I hit organic chemistry and realized I don't really know if this is for me. But I had phenomenal instructors, but I ended up taking a medical terminology class that I did really well in. And my teacher for that class also happened to be the program director for respiratory therapy. And in our school at the time, the respiratory therapy, department was at the bottom of the building and nursing was on top. So it's like they always had this joke where, you don't make it upstairs, come on downstairs. But nursing was never really something that I thought I would do. Not for any reason besides I just thought I was just going to be a doctor. But my dad is a retired nurse for 35 years. a lot of my aunts, my mom's siblings are nurses. They're also retired, but I was always in the hospital, always around, medical personnel, always. So I knew that I wanted to work in a hospital. So I joined the program, and it just worked really, really well. It just kind of sucked me in, and for me, like a lot of kids, especially like I noticed in Baltimore and a lot of urban cities, like asthma is a huge issue, and I have suffered from asthma my entire life. But funny enough, I never ever knew a respiratory therapist. I just didn't know who these people were coming in to give me breathing treatments as a kid, things like that. Um, so as I got older, and got into this program and really saw who these people were, and I had been seeing them my whole life, had not, had have any idea who they were. It kind of drew me to it, and almost 10 years later, here I am.
Awesome. Can we backtrack a little bit? I'm learning how to use this technology, and we need to welcome Dr. Samuel to the panel. Dr. Samuel, we're just introducing ourselves and explaining why we chose the career. So, Dr. Samuel, we have Ashley, Jovalie, Dr. Watkins, and Tiffany on the panel right now.
Hi, everyone. Nice to meet you.
Hello.
My name is Jonelle Samuel, and I'm obstetrician gynecologist. In terms of why I chose this career, I think it's like the best of both worlds. One, me being a woman, I understand what it means to be a woman. I understand, a lot of stuff that women go through. So that's one aspect of it. Also, two, the fact that this field allows you to, deliver babies. So it's one of the more happier fields. Out of medicine, you also get to deal with women throughout all their lifespan. So, young women, teenagers, adolescents, women in their 20s and 30s, women who are going through perimenopause or menopause, women who pass the age of menopause, little old ladies, like I love them all. So it's nice to kind of follow them throughout their life. And then also too, I love seeing them in the office. I love doing surgery. So OB/GYN allows you to do all of those aspects. So that's kind of what drew me to the field.
Awesome. Thank you, Dr. Samuel. And we're still on the question around why we chose the career that we're in. So I think we heard from a few people, Jovalie, Tiffany, and I think Dr. Watkins and Ashley.
Yeah. So I've kind of had a few career changes. I was doing like academic, like hospital-based medicine in the classic, like I'm an adult doctor, basically, internal medicine. So you get sick, you go to the hospital. I would be the person who take care of you in the ICU or on a regular internal medicine floor. But then November 2016 happened, and I was just like, whoa. I feel like I just wanted to do more because I was working at a university hospital in New York City, and it was like basically taking care of like rich old white people. And I was like, that's cool, but I don't know. It just felt like I could be doing more. And so that's, I was like on the way to work one day and I saw on the train, there was like an ad for the city free sexual health clinics. And I was just like, that sounds more like it. And, I just, looked and see if they had any openings. I applied, and then I just kind of made that switch. And then that's when I kind of got more exposed, to other parts of medicine and public health. Because, working in these free clinics, Baltimore City has two or had two. I've been to the Druid Hill clinic for like a training through Hopkins, but I think one of the other ones closed. So, just seeing how the role that public health plays in our lives, and our clinics are similar to the ones that Baltimore has. We're still dealing with the last big pandemic that hit the country and hit our people, and so dealing with pandemics for those 3 years kind of set me up for this new pandemic. And so it was kind of like Providence or something that I kind of fell into it. I guess that's kind of a theme. But knowing the overall thing was like looking out for folks and, giving back to the community and working in the community and making things better.
Awesome.
Okay. Well, I can say I think I've wanted to be a nurse since I was probably about 8. I watched a movie called Miss Evers' Boys. Now that I'm an adult, it hits differently, way differently. But as a kid and initially, I was like, oh my goodness, how cool would it be to be able to help the people in my community with my education? Like if I got a chance to go to college and learn something. I feel like the biggest downfall of our people is lack of education and resources. And sometimes they're out there and sometimes they're not. And sometimes you just have to run into the right gatekeeper. And I felt like I wanted to be that person. Growing up, moving forward, looking in life, I realized what a messed up situation they put that woman in. For our people, but I am now hopefully the good version of a community health nurse where I worked in clinics before in the health department and was able to guide young girls. Like you said, different women in different stages of their lives, and just be able to talk to them. I feel like I've been given a gift and a curse of communication, where people just talk to me. And probably, I don't think I would have made it as a psychologist, but that's if nursing doesn't work out, that might be option number 2. Or it was stewardess, but hey, planes might not be the best trip right now. So we're gonna go with the latter on that one. So yeah, basically just wanted to help out the community and use my knowledge and education to be able to talk to anybody, whether you have no education or you have more education than myself, and that's fine. We can still have a conversation, and I can learn something from you, and you can learn something from me. So that's what I love.
Awesome. I think you guys are really already answering this question, but I'm curious. I think the students will benefit from knowing what's a typical day look like for you. I think some of you already started to answer that question, but could you enlighten us on your day-to-day duties, if you will? Anyone can start off. Maybe that's not how you moderate, but
You want to keep the order? Stick to the order?
Yeah.
The order? Okay.
Easier.
Okay.
So I'll go.
Okay.
I think I'm first.
So Jolie, I write it down. Go ahead.
So a typical day. So oh man. So I work on 2 units. One is a neurosurgical unit and one is like a mixed ICU COVID unit. And it just depends on the unit that I work on a given day. So I go to work, and then once I get to work, I see where I'm going to be, either the neurosurgical one or the other one. And then we do huddle, which is basically an overview of the patients on the unit, and which ones are acutely ill, which ones are more stable, who can transfer, who has like road trips to CT or MRI, things of that nature. Just a general overview of what's happening on the unit. And then I go and get reports from the off-going nurse. So I'm going to work tonight. So the day shift nurse who works from 7 a.m. to 7 p.m. will give me reports, and I'll work from 7 p.m. to 7 a.m. And basically they tell me, in the ICU, we have 2 patients because they are so acutely ill. Our patient load is smaller. So I will get report, which is basically another overview but a more in-depth, detailed overview of my patient assignment, their past medical history, any pertinent allergies, their history of present illness, like why they're here, any major events, and then you go through systems. So you start neurologically, and then you go system by system and basically get an in-depth review of what's going on with that patient. And then we do a neurological assessment together, the off-going nurse and the oncoming nurse, just to make sure that what you're telling the nurse is like actually what's going on with the patient. Because in the neuro ICU, things change very fast, and you can have a patient who was like fine talking to you coherent, and then they are not. And that can happen in change of shift. So you want to make sure that you're aware of any like sudden neurological change. And then I start my shift. And I look at my orders, I look at my medications, I assess my patients, and then whatever happens, happens. Like anything, anything can happen. We can get admissions. I can transfer patients. Sometimes I transfer both of my patients and get double admissions. Or sometimes you have like really. I just had a really sick, what they call 1-to-1. So a patient who's so acutely ill that you have one nurse solely responsible for managing that patient. And that was a very busy night, but very informative. So the thing I love about nursing, especially in the ICU, is that I'm always learning. Like for that patient, we put in a pulmonary artery catheter, which is something that we usually don't do on a neurosurgical ICU. And that experience was just like really cool to see. But yeah, that's basically the beginning part of my shift.
Awesome.
Well, my shift is typically like Joe believes. It starts off pretty much the same. I usually, because I'm respiratory, we don't have truly assigned units, but we have a little bit of seniority, so we kind of get our pick of where we like to go. And so typically, I work in our trauma hospital, but mainly in it's a lung rescue unit. So folks who have who need lung transplants and things like that. They're on a device called ECMO, stands for extracorporeal membrane oxygenation. So basically, this machine just is hooked up to you, and it runs tons of oxygen through it, and it literally acts like your lungs, and it can also act as your heart and do all the work of putting oxygen in your body and taking it out. So I typically work on that unit. But since COVID hit, that unit has turned into our main COVID ICU for some of our sickest people. And we actually have patients that come from all over the state, including Virginia, Delaware, Pennsylvania. We actually had the very first documented COVID case in Baltimore City that was on that unit. So pretty much like Joe believes, same thing. I see, okay, I'm on this unit. I'll get report and learn about what's going on with my patients if I haven't been there in a few days. So I also work nights. And because we don't have such a streamlined, process of, having to go through every single system, we focus on just pulmonary. So just lungs, pretty much. Typically, I can have anywhere between, in the ICU setting, anywhere between 3 to a good day is 3, but most times I have about 5 patients or more. But we also usually have other units and things like that that are much less acute. I mean, a typical day, we don't have typical days. Everything changes with respiratory, especially with these people who are so sick. You just really can't put your finger on, how the night's going to go. I had a surprise operating room travel last night. I was called to go to Northern Virginia to pick up a patient in an ambulance. So I also do that. I travel with our EMS team to go pick up really critically ill patients who have to be transported on a mechanical ventilator. And that's basically the crutch of what I do. I manage mechanical ventilators. The people who are just so sick and their lungs are so unhealthy and they just need help. So like I said, there is no standard day because, like she said, things can change in the drop of a hat. And recently we've had an uptick in a lot of young pregnant women who have contracted COVID, who also need ventilators, who need ECMO, who need all of these things. So I'm not what we call pediatric trained, but it's been a learning experience for me. And each patient since the beginning has taught me something new. So it's kind of opened my eyes to see, maybe different avenues of respiratory that I might want to try. because, like I said, there is no typical shift. It could be a really good shift where I'm chilling, kicking my feet up for 12 hours and checking the ventilator, maybe giving some treatments, doing, little things here. Or I could be moving the group from 7 p.m. to 7 a.m. But teamwork is the name of the game all the time. And that's what makes the shift, work. So, yeah.
Wow. Okay. Awesome. Thank you, Tiffany. Ashley.
Okay. So I am now a nurse manager. So I don't have the typical home visits anymore, but before this shift over, my typical day would be I would have 2 clients that we have enrolled in my hospital who recently delivered, and we check on them and make sure they're dealing with the after complications of having a baby and just making sure everything is good, not only health wise, but also socially as well. So I think I have like the best job ever. And I just truly love what I get to do. So we get to take the nursing aspect and then we're assessing them, making sure, back when we could go into the homes, we were checking blood pressures. I get to hold a new baby every day and give them back. And I have to worry about those things. But we would check the baby's weight, making sure they're growing, getting food, make sure the mom knows what they're doing. We have first time moms. We have moms. I've had a mom with 15 children birthed. I said, ooh, mercy. But we have to meet people where they are. Again, whether this is your first child or you've had some experience, we like to make sure you know the basics of safe sleep and just making sure you're bonding, getting everything together, that your house is in order, you're not having a slumlord that you're dealing with, and you got this new baby, and just making sure people have the resources that they need. So if somebody says, I don't know where I'm gonna send my child to daycare, we have a community advisory board and community specialists that we get with, and we basically link people up with resources. So I feel like I'm a social worker nurse, kind of, sort of. So we don't get to do the hands-on patient care anymore due to COVID, but we are still doing virtual visits and helping a lot of families get through not only this pandemic, but just dealing with life changes in general, especially when having a new child.
Awesome. Thank you, Ashley. And Julie and Dr. Watkins and Dr. Samuel, you guys can pick who's going to go.
I'll let you go, Dr. Samuel, because...
Okay, and I'll stick to the order.
Okay, so my day changes every day as well. So on the days that I'm in the office, which is the majority of the time, so my office hours usually between 8 and 4. So I see patients about every 15 minutes. So as I have women from all walks of life who come to me for whether it's prenatal visits, so they're pregnant, and so you're kind of assessing the mom and assessing the baby. We also have women who are not pregnant who come in with issues with bleeding or may have concerns regarding or decide wanting contraception. Women who have endometriosis, fibroids, ovarian cysts, the whole gamut. So those are the days I'm in office, and so that changes every day, all day. So I love that. And then the days that I'm on call, I am in the hospital, and I deal, I'm on the labor and delivery unit. So essentially I work with midwives and I work with nurses who, and we help to deliver babies. So moms who come in, who are in labor, sometimes we have to, induce labor, meaning putting somebody into labor. We deal with all sorts of, diagnoses. So sometimes, you have women who are very sick and may not even need to be delivered yet, but are very sick. So we deal with that. We also have a triage area for women who come in pregnant, having a number of issues, whether it's pain or whatnot. So, and that can be busy. Sometimes it, may not be nothing going on much at all. And then, you can snap a finger and it's just going downhill. Sometimes too, I also, do C-sections if a C-section is indicated. So all that. And then I have days when I'm in the operating room or OR. And on those days, depending on what I have scheduled, so I do a number of surgeries I perform. minor surgeries such as taking a look inside of the uterus, what they call a hysteroscopy, removing polyps, doing laparoscopies. So those are minimally invasive surgeries where you make a few small incisions in the abdomen and you're able to take a look under a camera, and removing cysts, removing abnormal implants, removing adhesions, fibroids, doing hysterectomies, which is removing the actual uterus, from the abdomen. So those are kind of like the majority of the surgeries. And sometimes too, you might also assist another attending or another physician with some of their procedures. So every week it's some sort of a mix of that.
Okay. Awesome.
I can go. So I, as a public health practitioner and an adult physician, I kind of see people in my sexual health clinic once a week. So it's pretty similar to what Dr. Samuel does. I see a lot of like women who are interested in pregnancy or interested in contraception, and with their just general like regular like wellness visits. I also see a lot of male people. We also focus a lot on queer health. We see a few trans patients regularly in our clinics and talk about like HIV prevention and just general health stuff. And then because of the COVID crisis, every other day I'm working on a few different projects. Currently, early I was like a early contact tracer. Then I was working on the health department's, I guess, what you would call like the end of the poison control line. People who were calling poison control, if they needed to talk to a physician, I was like on the other end of the line for that. And then I was working, doing a lot of stuff, but now I'm basically working on vaccines full time. And that's just been its own thing. So just developing like a educational program for the health department. Also, we're going to work with the other city agencies. Like there's like 70 something agencies in New York City for like the fire department, the police department, all these other departments to kind of like help give them information about the vaccine. So that's kind of cool too. Just like I'm kind of getting back into like my teacher education mode / like public health. It's like, so it's kind of cool to be in the government in a way, and to like be in meetings with some people you see like on TV or something. That's kind of cool. I talked to that guy, so that's kind of cool.
I think it's cool when you do your broadcast and I see you.
Oh, okay.
All right. So let's go with the order, as Dr. Watkins said. So the next question is, would you describe your educational training? Would you describe your educational training? So if so, students are thinking, how do I become a respiratory therapist or a physician or a nurse? What are the educational steps that they would take? So would you please describe your educational training? And we can begin with Ms. Thompson.
Okay. So I have a master's in nursing. You don't need a master's to practice nursing. But I got a bachelor's. I went to Dartmouth College for my undergrad, and I got a bachelor's in neuroscience, and I minored in French as well. And then after I figured out that I wanted to be a nurse, I went and did an additional degree. There are second degree bachelor programs that institutions have, but I went to Johns Hopkins for their master's entry level nursing program. And it's for people who have a bachelor's in something else and want to be nurses, but don't want another bachelor's. So you can get a master's in nursing. And I want to build on, eventually, I want to go back to school. And I'm pretty sure I want to go the CRNA route, which is a certified registered nurse anesthetist.
Wow.
Yes. So that's the doctorate of nursing practice degree. And yeah.
Awesome. And the order is Tiffany. Tiffany, you're next.
Okay. So we have in respiratory therapy, there's two programs. Now, the majority of the programs in America are associate degree programs, meaning it's only a 2-year program. So the school that I went to, although it was a 2-year program, I was there for 4 years because, like I said, I intended to go the pre-med route. So I was taking tons of biologies and other, sciences, chemistries, biochemistry, all those things. So when I graduated, although I graduated with my associates from a 4-year school, I had all the prerequisites for a bachelor's degree. So, and I went to what's called now Washington Adventist University. So it was only an associate's degree, which was totally fine, entry level degree for respiratory therapy. Now, there are a few schools in the country that do have 4-year programs. One in Maryland is Salisbury University on the Eastern Shore. A lot of my coworkers come from there. It's a great program. And UDC, if I'm not mistaken, in Washington, D.C. is also a bachelor's degree program. Then after kind of just finally getting the nerve and deciding to go back to school, I did an online bachelor's of respiratory care program. So it was, I did the accelerated track. A lot of these online schools do that. So if you have what is called, because I'm a registered respiratory therapist, we also have a certified respiratory therapist. There is truly no difference in the two. You can do the same work. It's just one, you just take an extra test. Excuse me. So I actually just graduated with my bachelor's in May of this year because, thank you, I know that eventually we're going that route, just like nursing. A lot of nurses are, transitioning from that associate's, program to a BSN, and respiratory is kind of trying to follow in those footsteps. So I just wanted to get a jump on getting my bachelor's while it was still on my terms, and while, potentially my job wasn't, telling me, hey, you have to have this, or, so it's typically a 2 to 4 year program. You do a lot of sciences, and it's heavy on things like mechanical ventilation, because that's what we are considered the experts in, mechanical ventilation, a lot of things that deal with the lungs. And you learn basically all the ins and outs about the job, how to put in breathing tubes, how to manage the mechanical ventilators, how to manage all different types of equipment that keep everyone alive, from the teeniest babies to the oldest patients, from the most traumatic injuries to, people who are having asthma attacks. So every program is structurally, the same, but you might learn a few different things here and there. But the bulk of your education comes from clinical experience. So we do a lot of clinicals after our the end of our first year, kind of going into our second year. So from that summer on to the end of school through graduation, you were in the hospital at the bedside. So even though we're not a real respiratory therapist at the time, we're still students. There are actual respiratory therapists and our clinical instructors are taking us around the bedside, and you go through different hospitals or clinical sites each semester, and you kind of learn what those places do, how they function. So for instance, for me, I got to spend time at Washington Adventist Hospital for a little bit. The majority of my clinicals was at Washington Hospital Center in DC, as well as Children's in DC. So I saw a myriad of cases, from, like I said, the sickest babies to being there when Senator Kennedy was there. So we kind of had Washington Hospital Center. So we saw a lot of things. But like I said, tell everyone, the majority of what you learn in school comes from being at the bedside and really getting that clinical knowledge. So when you get to work and get a job, all those things come into play.
Awesome. Thank you so much, Tiffany. And congratulations on graduating. All right. Congrats. According to the order, Ashley's next.
I really think it's Dr. Samuel, but I will roll with the order. So I, again, in knowing that that I wanted to do nursing in high school, I took a vocational course. I don't know what I was going for exactly. I just knew it had health in it, and I was like, "Ooh, health! I want to deal with health." In the school that I went to, it was called Diversified Health Occupations, and unknowing at the time, but it really set up for some great things in life. In high school, I was able to work as a state tested nurse aide. Got trained in this class in high school, learned vital signs, different just general basic nursing stuff, but it wasn't nursing. I did not know that. And was able to make a decent amount of money in high school that was very unthought of in the 99 and the 2000s. It was an interesting time. So
It was legal money, Ashley.
I was like, wait a minute. So did that in high school. My family, college was not an option. It was, you're going to college, period. I know everybody's family ain't set up like that. But there are different routes. Just know if you feel like college is not for you, you can definitely still be somewhere in or around that field and still make a decent amount of money. But if you can go for college and get somebody to pay for it, please do it. Please do it. So went from high school, graduated. I was in a program called the YMCA Black Achievers, and I applied for every college, was on every random swim team, volleyball, all the stuff that Black people really don't do, to try to get more money. My GPA was cool, activities, all that good stuff, but was really trying to get that free money for college. And I probably got about $5,000 from one school, and I was like, "Oh, that's not gonna do. And ended up getting a full ride scholarship to Northern Kentucky University, and took it. Was not planning on staying anywhere close to Cincinnati or anywhere, but definitely not being in debt for those first 4 years. I ended up doing 5 because I'm hard headed. Yep, went to Northern Kentucky University, studied all the sciences, all that good stuff. And here we are. It took me a while to pass boards, but that's a whole nother story. I'm not a test taker. I can talk to you. I don't want to write it down and I don't want to click, but definitely I would suggest, if you can, start off as a CNA, get that base, get the hands-on, the real groundwork, and then build your way up to nursing, or at least work somewhere in that field so you can see what really goes on and what the different sectors do. Because CNAs, nurses, doctors, respiratory therapists, it all might look the same or do, but we all got different jobs. And somebody said teamwork make the dream work. If that ain't the truth of all truths, we all work together to try to get everyone together. So thank you everyone for what y'all do. I just love y'all.
Awesome. Thank you, Ashley, for your insight. Dr. Samuel, then Dr. Watkins.
All right, so I'll talk about the journey to becoming an OBGYN. So you have 4 years of college, and then after 4 years of college, 4 years of medical school. And then after you graduate from medical school, you do 4 years of an obstetrics and gynecology residency. Now, for me, I didn't exactly follow that path, although that was my intention initially, but not always how you think it's going to happen is how it happens. So after I graduated from college, my thought was that, straight to med school, that's what I was going to do. Applied to all these schools. For whatever reason, I think, with test scores, I didn't get into a lot of schools. And so the one school that I did get into, I was like, you know what, I think I need some, like a little bit of time off. So I got accepted into medical school, Howard, and I took a year off, deferred for a year, and I worked at the National Institutes of Health. And I specifically worked in their reproductive unit, one of the other, reasons as to what made me interested in women's health. So I worked there for a year, 9 to 5. Loved that because it was the first time I ever experienced it. And if I were to do it all over again, I would do that again, and learned a lot. And then after that, started medical school. So then did medical school for 4 years, then graduated. Then I did residency for an additional long 4 years. And then after finishing residency, now I'm what they call like a practicing physician. And then throughout all of that, which I'll just touch on briefly, so you have a series of exams that you have to take. So we have what we call step 1, step 2, and step 3. Step 1 and step 2 are usually done in your medical school years. And so those are standardized tests that all medical students all over take. During medical school, it's broken up. The first 2 years, you have like your basic sciences, and then the last 2 years is more so clinical. So you are, rotating throughout different, specialties. So general surgery, OBGYN, internal medicine, pediatrics. So it kind of helps to get you geared, or, find out what are you interested in. Which it's, short period of time for you to kind of figure that out, but that's what it's helps you to do. And also, kind of, dabble in all of those things. I forgot what else I was going to say. But yeah, so those tests. And then when you go to, so for residency for me, then I have to take, a specialty boards for my residency for OBGYN. So I have what we call a written boards and an oral board. So the written boards, I took that. I actually did not pass that the first time I took it. But I did pass it the second time. And then my oral boards, which I just took in 2019, which thankfully I did pass on the first time. So I'm what you would consider, fully board certified at this time. So that's kind of the road for OBGYN.
Thank you for being vulnerable, Dr. Samuel, and sharing your experience with perseverance. Mm-hmm. So thank you.
What class of HUCM are you?
2012.
Oh, we crossed over. I'm 2011.
Are you 2011?
2011.
Okay.
Yeah, we went to the same med school. That's funny. But it's a big school, so it's not surprising that you don't know everybody. Yeah. This is my 10-year anniversary, which is crazy to say. So basically for most physicians, there's like that standard, you get undergrad, you do med school, and then you and after med school, that's when you kind of like declare what your specialty is. And I chose internal medicine. It's a non-surgical specialty. It's a 3-year base residency program. I did an additional chief resident year. And I was kind of like, I was the primary care / academic chief resident. So I kind of like was running one of the student run clinics. I was like the chief resident. They're like all the residents who are working at the free clinic for Jackson Memorial Hospital, which is one of the largest public hospitals in the country. I think the second largest, definitely the biggest in South Florida. So it was like a free public hospital for a lot of people, immigrants, a lot of poor folks, a lot of folks who are kind of left on the margins. So that was like my first, like me trying to like really like affect change in folks' lives. And then now I've been practicing. I was, more clinical in hospitals, not of them in like public health, considering a master's in public health, but only if someone else pays for it. So just know that people can pay for your things. And I guess the last thing is just like, all of our paths are very different. And, as long as you know where you're trying to go, if you have some diversions and roadblocks and detours along the way, just keep your eye on the prize and you'll get there.
And Ursula, I wanted to add one more thing I forgot to mention. With OBGYN, there are other subspecialties that you may be interested in. So for example, they have what we call maternal fetal medicine. So those are specialists who deal with women in high-risk pregnancies. Then we also have gynecologic oncology. So those are gynecologists who deal with cancer cases, so of the woman's genital tract, so of the uterus, the ovaries, the cervix, and the tubes. And then you also have, a newer fellowship now, minimally invasive gynecologic surgery, we call it MIGS. So those are gynecologists that specialize just in minimally invasive surgery. You also have what we call urogynecologists, so they specialize in pelvic floor health. And so those usually are an additional 2 to 3 years after the routine 4 years of OBGYN residency if you want to further specialize in those.
I'll piggyback and say internal medicine is a similar kind of setup where the base discipline is the 3 years. And then after that, you can go to be a cardiologist. You can be a lung doctor, a pulmonologist, you can be a kidney doctor, and so their medicine kind of works. You kind of pick up one track and then from there you can build on it and kind of go from there. Yeah.
Okay. Awesome. Thank you guys for your insight. And I had to say thanks for sharing the real struggle, because I have a nurse in my house that is on the struggle bus herself. So that's what I meant. Thanks for sharing the honesty about that career pathway. I just want to ask one more question, and it'll be a closing question. It'll be a double question. And the question is, what's the most rewarding part of your career? And this is, you're speaking to students, they'll see this video. What's the most rewarding part of your career? And what advice would you share with students who want to go in that career pathway?
Okay, so, oh my goodness. The most rewarding part, I mean, okay, so I haven't been a nurse that long, so I feel like my understanding is going to mature over time. But from what I have experienced, it is definitely the interpersonal impact that you have in people's lives, especially working in the ICU. Like, the patients that you get are at the lowest point of their lives, like, and their families, you know, nurses are the link for a lot of different specialties and interdisciplinary professions. So being able to help to coordinate that care and advocating for patients. The healthcare system is very hierarchical. It's very there's a lot of like channels to go through and a lot of chains to go through. But it can be frustrating at times to try to enact change in your little corner of the world. But I think it's the most rewarding feeling that I felt has been when my patients have told me, like, you have made my time in the hospital better. You know, you have made this awful experience better. So, yeah. And then advice, especially being Black in healthcare. If you believe in God, pray. And know that you are enough. You are competent. You are sufficient, you know, in and of yourself. You don't need external validation, you know, to really do what you need, to do what you have in your heart to do, the passion that burns within you to do. Like, in order to fulfill that, like, all you that you require is you. And a lot of naysayers will come and try to push you off of that course, or just life, you know, certain circumstances and environmental issues will try to, like, push you off of that course and that passion. But you are enough. That would be the advice I could give.
Yeah.
Thank you.
I agree. So my most rewarding, I mean, just seeing people be able to get off of that ventilator and go home to their families in a shift is always the most rewarding. Seeing people who have been so sick, on the brink of death many times, and I've been able to be a part of those cases where, you know, we've made a difference. But the one thing, like Joe said, like, that will always stick in my mind was I had a patient, an elderly lady, and I'll never forget, I walked in to, you know, assess her and do a breathing treatment, and she gave me the little old lady. And I kind of go in there, and she asked me, and I introduced myself, and I'll never forget what she said for the rest of my life. She told me, "I've been here for 2 weeks, and you're the first person that looks like me who's coming here to take care of me and not pick up my trash, not deliver my food tray." And it took me a minute to kind of, you know, because, and my coworkers and I, we talk about it a lot. Working and living in Baltimore City, the majority of African Americans that you see working in my hospital are in housekeeping. They're in food services. And not that there's anything wrong with that, because again, they're part of the team. Every little bit counts in a hospital. But the fact that the majority of our patient population looks like me, and they don't have someone who looks like them, being able to, work with them and help them, because, I can sometimes see the confusion in their faces when they are speaking to doctors. And it's like, there is a communication barrier. And it's not so much that they're at the education level, but they don't understand. I do believe that a lot of African American patients need African American healthcare providers, just from the basis of just commonality, and for her to say that to me, it's probably happened about maybe 5 or 6 years ago now. And I'll never forget it. And so I always try to make it a point that when I have an African American, especially an older one, or someone who's, younger, when I see the doctor go in, I go in. So just in case, hey, do you have any questions? I can have them come back in, or if I could help you understand, but I know that when they see someone that looks like them, they're way more comfortable, to ask questions and things like that. So I feel like as African Americans, I feel like healthcare is something that is important for us to be in, whether it's bedside, whether it's case management, whether it's being a physician, a nurse, anything, because we need to be there for folks, and that probably will always stick with me forever. Now, advice, go to whatever college gives you the most money and allows you to stay out of the least amount of debt. Don't be afraid to branch out and leave home. I didn't think that I would ever leave New York. And here I am. I love Baltimore. Second home. Love it. I live in West Baltimore. It's probably one of the most underserved areas in the city, but I love it. Wouldn't have it any other way. Don't be afraid to fail. When I took my first class, passed on the first try. Took the second part, passed on the first try. Took that third part, and I failed it 3 times. I was so discouraged. And 6 years later, I finally got the nerve to just study, because I'm not a good test taker, but I studied and I studied. I got help. Don't ever be afraid to ask for help. And with my community, with coworkers, friends, family, I passed. And, you're going to fail, but you learn from those failures, and you have to keep pushing. And again, you build your community of healthcare providers, you build your community of friends, and you just know that there are people out there who look like you, who want you to succeed, and they will help you in any way they can. So that's the best advice that I could think to give you. Go for it. Respiratory is a fantastic career choice, but don't stop there. Start respiratory. Become a nurse. Become a doctor. I literally have a friend who's an RT, went to nursing school, and she just graduated from med school last year. So she kind of saw every single one of our jobs in her short, 30 years of life. So whatever it is that you want to do, put your whole heart into it, study hard, work hard, and you can do it.
Thank you. Thank you. Thank you.
I think that those was like the best advice giving and hopefully taking responses. Everything that they said, it's going to be a struggle. My grandma always kept saying they gonna keep moving the bar on you, and I'm like, what does that mean? Like, ain't nobody hopping over no bars. So really wasn't understanding what that meant. But at some point in time, it was okay to just have your GED or your high school diploma, and then it was like, all right, now if you really want to do something, you got to have a bachelor's. And then kind of now that everybody getting bachelor's, they like, all right, we gonna need you to have a master's. So definitely take some time. I think my advice would be to take some time to really, you might not have you all figured out. It's some truly adults who haven't figured everything out yet, but find what your passion is, find what your gifts are, find something that excites you, that you would like to do. You don't necessarily have to do this for the rest of your life. If it works out that way, that's awesome. But just find something that makes you happy and you feel like, you're able to contribute and do. But people will tell you no. I had a college counselor that changed my classes because I wasn't strong in math and sciences. Changed my classes to social work. I said, I'm not going to be a social worker. I'm going to be a nurse. And the day of graduation, she's like, I knew you could make it. No, you didn't. But I'm here. And I'm going to prance across this little stage. Just like we're going to do. Again, adversities will come and show up. So just power through. Again, I was hard-headed and I like to have a lot of fun, and I enjoy college to the fullest. Okay, it was the best time of my life. The best time. Joined sororities, met some of the best people that I've ever known. Shout out to Zeta Phi Beta Sorority Incorporated. Compliments of Howard. So definitely had a lot of fun in college. If I could go back and do it again, maybe not so much fun, and buckle down a little bit more. And I feel like some things would have kind of stuck with me, but that's me. And I'm gonna try to use, as I say, my gatekeeping to try to do something good for the benefits of this world. So if you get stuck, don't worry, you can pick back up, find what you want to do, find what makes you happy, and enjoy, learn lots, travel abroad, especially if somebody paying for it, just enjoy. Okay, just enjoy and learn lots and go change the world however you're supposed to do it.
Thank you.
So I would say the best part of my career would be twofold. I love when women, after helping them, most of the time also with bleeding issues and, like their quality of life has dramatically changed and they thank me, that's very rewarding to me. And then also to, bringing life into the world. I just think the process of pregnancy and birth is just amazing to me. It's just absolutely amazing. In regards to, what advice I would give, I think what everyone said was excellent. Only thing I would add, not being afraid of failure, you're picking yourself back up, perseverance, also being intelligent and being diligent. So surround yourself, not only with like-minded people, but surround yourself with like-minded people, explore, look at different internships or, summer opportunities or travel abroad or find a mentor. You can reach, I'm sure, to any one of us, find somebody that looks like you. So if you know that you're interested in healthcare, go towards that. So that's what I say, be intentional, empower yourself, and just not being afraid to fail. And don't allow anyone to tell you that you're not good enough, that you don't have, the skills to do something. Just allow that to empower you and make you work even harder and stronger and essentially show them and prove to yourself what you already know. And that's what I would say.
Appreciate it.
I would say, you guys are really great and really inspiring. So thanks for sharing all of that. I would just say also, I guess, in addition to all of the wonderful things, I think my biggest thing is just realizing that you're bigger than whatever box people want to put you in, and don't for a second believe whatever they think it is. Like you're bigger than all of that. And we have this really strong tradition as Black people of color, of like really paying respect to your ancestors. And just when I think about that, it's like my grandma used to, my dad's mom used to be the lady cleaning the hospital, and people would tell her that you'll never be nothing, or my other grandma was a nanny taking care of some other people's kids, and so I bring their spirits with me in every room, in every exam room, and I'm proving those folks wrong, and just know that you're bigger and better than whatever they could ever put you in, and really embrace that, and also just go into it with an open heart and an open mind. Follow your dreams, all of that stuff. But also you got to, try to come correct, so that they can doubt all they want, but you come correct, you show up and you bring all of you into that space, and you just do what you got to do. You pop off, and, that's the advice. but also having, really seeking out folks who can see your worth and can give you that validation, and people who can look out for you, people who can give you advice. Sometimes it comes in the form of someone who may not look like you, but if you feel that connection, don't be afraid to like, hey, can I like talk to you or ask you a question? And you'll be surprised some people who'll be open and would really, take an interest in you and maybe help guide you. And, when people say it, believe it. But also people show you stuff, believe that too. So, it's a double-edged sword, but, this is a really interesting time for us. There's a lot of, the world is changing all around us. We're in a pandemic. And you think about the last pandemic, what happened with the HIV crisis, the world changed forever. And this is going to change the world forever. There are going to be new things that we can get into, new roles, new jobs that are going to be created, new ways to do healthcare and practice it. So also keep your mind open, keep your eyes open for that too. Because if you see something, if you want to see something in the world and it's not there, maybe that's for you to, maybe it's for you to create and you to feel it. So that was a lot to say, follow your heart.
Thank you so much. Thank you everyone for coming through. I feel so happy, honored, and privileged that you would spend your time with the students. They're going to really benefit from this. I appreciate you guys. I don't know what to say. The advice makes me want to cry and smile at once. But thank you guys so much for sharing with the next generation. And thank you for your work that you're doing right now. You are appreciated. You are affirmed. And I'm so proud and happy to know you guys. Thank you so much. I really appreciate it. We appreciate it.
Thank you. Thanks for having
Thank you.
Thanks for having us.
No problem. Thank you.
And if anybody needs my contact or has any additional questions, please feel free. Dr. Samuel, I want to get with you. I need everything of yours. I definitely want to get with you, Mr. OBGYN. And
everybody right here. I think we need to have a little powwow.
I think we need a side group meeting on how to do some things.
Thank you guys.
Bye, folks.
Nice meeting y'all.
Absolutely. You guys will do great. Good luck in everything you do. Thank you, Ursula.
Thank you.
Thank you guys.
Yes. Oh.
Be safe. Be safe. All right, good folks.
Ciao.
This was awesome. Your class is going to be so great.
Yeah, you guys really helped the kids out. I appreciate it. This is really cool. Thanks for bringing that information about the fact that you started your career as a CNA through your high school program. That's dope, because our school actually has a CNA program. Our high school does.
I'm telling, hey, $17 for a high schooler back in the 99 and the 2000s.
That's big.
You couldn't tell me nothing. Had my golds, had my little spray painted t-shirts. You couldn't tell me nothing.
That's big. That's big.
But seriously, my walk and journey through college and nursing is definitely so non-traditional. So if you have any students who have any difficulties, or they not good at test taking, or whatever, honestly, I've seen and done it all. And I'm supporting for you. I'm supporting everything that you do.
Listen, it's the same thing here, Ashley. You know that already.
Already.
Keep that in mind for sure. Had some water spill over here. I had to get up.
Look, had a little drip, and the plant was colorful. It was so green and luscious in the background. It was like, I need some hydration too.
You're right.
So I'm down here because my kid's about to kick down this door. Okay. I don't know if you
told him an hour. He just said an hour's over, Mama.
Look, they said give us free or at least dinner.
Right.
All right, sis. I'm gonna text you my my number and email for the job.
Okay, awesome.
The official.
Thank you.
All right, then.
All right.
Have a good day.